friends, I'm Dr. Abdequaem. Let me share you one small case, a very small case, but an important remedy which came out while prescribing. That patient was suffering from a boil, the lower extremity. In fact, he had that boil maybe 2 years back, was treated, but it again came in that same area. And that area became blackish in color, bluish in color, lead-like colored wounds. 2-3 areas there was reopening of the wound with pus. And the area around that was, as I told you, bluish, blackish, lead colors, different patches. So in this case, what do you think about? The only symptom which I took for prescription was reopening of the old wound, and the discoloration of the wound, bluish, blackish in color. In fact, when the blood was oozing out of that wound, it was black in color, and below that it was lead color also. So variety of colors, reopening of the wounds, black color of the blood, and the patient had thirst for large quantity of water. And whenever the patient used to hang down the limbs, the wound used to aggravate, or the patient used to feel pain in that area. What do you think of the drug? Which drug should be given? Now, a very short case. Sometimes we always think about our basic drugs like sulfur, like Hiparsulf, maybe like Silesia. Old psychiatrists again come back. But in Silesia, you have to differentiate. The wound does not have this type of discolorations, which this patient had. So, by this symptom, I gave the patient. Now, imagine a condition: a wound, reopening of old wound, pus discharge, around the wound blackish and bluish discoloration, discharge of blood black, thirst for large quantity of water, and when the limbs are hanging down, there was excruciating pain. The patient had to raise the leg and rest the leg, so he used to feel better. And one symptom which was very rare, the patient told me, that was that the pain, there is a burning pain in the foot and the heel which extends to the tongue. Now, burning pain in the foot and the heel which extends to the tongue, this was a symptom the patient came to me. If I had to prescribe, what drug will it be? I gave this patient Vipera. And Vipera, it is written in a Mater Medica, reopening of the old wounds. And with Vipera 200, I got fantastic results. I took the follow-up of the patients for 1 year, and that wound never came back. It was totally cured. That is the beauty of Vipera, prepared from snake. So this was a small case which I shared with you. Then, as I studied Vipera in Mater Medica, I will add few more symptoms of Vipera which I then saw in my practice. That is a very important drug for varicose vein. Varicose vein, so much so the patient feels the blood is accumulated so much, it feels as if it will burst. The veins will burst. There is so much pain and there's so much tortuosity in that vein that it will burst. That sensation, the patient will come and tell you, Doctor साहब इतना ज़्यादा blood भर जाता चलने के टाइम पे, ऐसा लगता फट जाएगा vein मेरा. And that is Vipera. He is talking about Vipera, the only drug given in this symptom, that is bursting of vein. The patient feels the vein is full of blood, it will burst open. The only drug, that is Vipera. Second, wounds bleed in Vipera and the color is black blood. See that case? The wound, black blood. The same symptom, wound will bleed open with black blood. In Vipera, if you see the skin of the patient, the veins around it, that is discoloration, and you can get variety of symptom in that: redness, discoloration, discoloration in spots, discoloration bluish, discoloration reddish, discoloration lead-like colored, all type of discoloration because of that varicose vein or because of the blood in Vipera. That is important in Vipera. Discoloration of wounds or discoloration of the area of skin. Second, if you see black spots, bluish spots, reddish spots in Vipera, very easy to speak, but if you see a Mater Medica, the only drug in this symptom, that is black spots, blue spots, reddish spot, the only drug it is written Vipera. So my friends, don't forget Vipera and discoloration. Second, a very important symptom I read in Vipera, that is always desires to go home. We have lot many drugs for homesickness. We have the acid force, we have those drugs, but in Vipera also it is written home desires to go. The patient wants to go home. Imagine a condition of varicose veins so bad, he is hospitalized, but he says, no doctor, I have to go home, I don't want to do operation. In that condition, my friend, at least give him Vipera and you will see the miraculous results within 24 hours. I have seen a lot many of cases in mine. Home desires to go, and that is Vipera. One more symptom which I have seen in Vipera is this Vipera patient has had a tendency to fall on the left side, tendency to fall on the left side. And one more symptom, a Vipera patient has pain in the knees, stitching type of pain, and the modality of Vipera is very important. He has stitching pain in the knees which is aggravated when the weather changes, means from autumn to spring, from spring to fall. When the weather, the patient, डॉक्टर साहब जब भी अभी समर है ना तो कोई बात नहीं, अभी जब समर से विंटर आएगा ना, जैसे जून जुलाई का महीना शुरू होगा मेरे को पेन शुरू हो जाएगा, फिर ठीक रहेगा, फिर ठंडी में पेन रहेगा, फिर जैसे गर्मी आएगी फिर मेरे को शुरू हो जाता है घुटने में. Stitching pain in the knees aggravated from weather changes. The drug is Vipera, and my friends, the only drug in the whole Mater Medica, stitching pain in the knees aggravated from weather changes, is Vipera. If you get this symptom, please do prescribe. Vipera will work. In fact, it will cure the complaints. That is the meaning. That is the importance of Vipera. And the sensation which I told you, that pain in the heels and pain in the foot extend down to the tongue. That is a very important pain of Vipera. As related to one symptom I have seen when I had a case of tonsillitis, when there is pus, you see pus pockets in that tonsils. So I gave the patient Prata-carbid failed, Hepacillin failed. But in Vipera, one symptom is important in tonsillitis, that is caseous deposits in tonsils. Caseation. Caseous deposit in tonsils. Vipera also is one of the most important drug in these symptoms. So my friends, this is in short Vipera I use in my practice with this symptom. One short case I told you about the wound, and rest symptom of Vipera I have told you. Go home and again read, and next time if you get a case of Vipera and you cure that case, do remember me. Do remember to post so that I also know that Homeopathy is working and I have done my bit in telling you symptoms of Vipera. If you like the video, please do share and subscribe. Thank you.